our agenda slide here. I can't tell. Are you able to see my slide here with the agenda on it? All right,
Yes.
fantastic. Thank you. Okay, so I would like to welcome you to our February regional nurse meeting. We are pleased to have us joining us, Ray Eichmeyer from the regional director of EMS for the Lake Chelan Health. Sorry, Ray, I didn't get a bio from you, so I don't get to discuss all your accolades. You'll have to give us a little bit of your background when you present to us. So today we're going to be hearing from Ray as well as Mike Dingle, who is the student safety consultant here at the ESD, to discuss some safety considerations for us in our health rooms as well. And then we will be having our regional nurse updates from Kathy. So just a few reminders that this meeting is being recorded. Oh, sorry, back up really quick. We do have a meeting agenda or a meeting objective to better understand emergency response and coordination in our region and in our schools. And hopefully we can come away from this meeting identifying 2 or more practices that we can incorporate that will enhance safety and efficiency during emergencies at our schools. I put the framework for I just had a blank, sorry, our school nurse framework for what we do and how we advance our practice. I put that on the slide so that way you can be thinking about where this meeting will fall in under the framework. And then reminders that this meeting is being recorded, so please keep your microphone muted. If you need to ask a question or have a comment, please by all means raise your hand or put your comment in the chat so we can ask for you if you need to. Also, the clock hours are available for the meeting, and we can talk about that a little bit more at the end of the meeting. All right, so without further ado, I'm going to turn the time over to Ray to share with us about regional emergency coordination.
Sorry, I had to find my mute button. Somehow lost it. I was trying to like view all you guys, so it's hidden in the corner. I'm gonna go ahead and share a little PowerPoint here that we can kind of discuss. Up. You guys see that okay? So I'm open to questions as we go along, and Lene, if you can kind of like watch people for me because I can't see both at the same time, and let me know if someone asks a question so I can definitely
Will do.
address that.
Will do.
So I'm the EMS director for Lake Chelan Health. I have a pretty extensive history of preparedness. I'm a hazmat tech and a registered healthcare safety officer. And so um, I'm just going to go over kind of what we're doing or what we currently have as a plan
Hey,
for,
Ray,
yeah.
sorry to interrupt. Would you mind putting your screen as a display? Sheila had her hand raised, and I'm thinking that might be what she was going to ask.
Yeah, he could go to slideshow right there on the top. There you go.
Perfect. Thank you.
Sorry about that. So, so the goals for the day is kind of, I want to show you a global review of preparedness federally, statewide, regionally, and local. Kind of talk to you about what the Healthcare Coalition does, what the DMC's role is. Some of these might be new terms for you, so I'm just going to throw a bunch of terms out so you kind of know what those are. What we newly formed with the Healthcare Alliance and its roles. I'm going to show you a couple resources we have in the region, and then I'm going to kind of talk to you about our plans. And then I really want to discuss gaps and really kind of dig into how important your guys' role is actually in preparedness, and how I feel like we're missing out not having you guys involved. And we need you guys involved more to be um, I would say a safer safety net for the community. So um, I'm just going to jump right in. So uh, after 9/11, um, it was determined that we did not have a really good national response framework. Before 9/11, there was some movement before that. Probably Mike Dingle remembers because he's been around since the earth cooled. And so there was some movement, and then when 9/11 happened, it was a rapid jump into, and there's money and resources put into creating a national response framework. And the key principles were engage partnership, having a tiered response, being scalable, flexible, and adaptable, and unity with command and language. And so each state, jurisdiction, counties had their own way, and the national response framework was like, let's put everything all together and make it one way, and made national training, which some of you have probably taken, like NIMSIS and or NIMS and ICS. So with that response framework from the federal government, they made all these categories of response. And the one we're kind of going to be talking about highlighting here is ESF 8. Now, some of these, as you know, they dovetail or sometimes overlap, right? So firefighting could also be emergency services, and you could kind of see emergency management could also be public health, and they've kind of, overlap each other. Oops, sorry. So for the national preparedness, we have the DoD, Department of Defense, Health and Human Services, which is the CDC, and Assistant Secretary of Preparedness Response, or ASPR. And they run these Medical Reserve Corps, DMAT, assistant teams, DMART, and then there's a couple other ones that I'm missing. There's one for like body recovery, and then there's FMS, which is called Federal Medical Stations. There's not that many of these, and then Homeland Security, which is FEMA, ESF 8, and CERT teams. So all of this kind of, I'm just kind of showing you the structure. So like who's in charge of what. Emergency management for Washington State, it has the ability to have the Washington State Military Department or National Guard. Department of Health is responsible for these things here, which is the Healthcare Coalition's FEFR program, which is really public health. And we have the National Strategic Stockpile. We have one of them in the state of Washington, hidden in a secret location on the west side. And then we have hospital clinics and SNFs kind of part of that. And then we have para organizations like Red Cross and other nonprofit organizations that also help with preparedness or response to the preparedness too. And so with the Healthcare Coalition, the goal was to bring all healthcare organizations under like one committee to work together on making a plan to respond. And that would include emergency management and public health. And so with that, there was each county is responsible to have a county emergency operating plan, and that is done every year by each county EM. And then also there is a local emergency preparedness, which EM runs, which is another preparedness group. They have also emergency workers program where you can get an emergency workers card through through EM, where they kind of already certify you and vet you to help with emergencies. And then there's some CERT teams, which is usually under the fire department, and that's a different that's under ESF 4. So I'm really and then we have public health, which has the FIFA program of like funding that comes from the state to help with preparedness. And then we have the public health officers. And so the reason I really kind of pull these guys out is the public health officer in Washington state. Now, this is not all states, has probably the largest power of the state of Washington. And so it was written way back early on in law that the public health officer can do martial law that can close counties and roads. They could indefinitely, if they want to. They could do way more power than our governor can. And the reason is they wanted to make sure if a boat coming onto shore or had a whole bunch of infection of, whatever, smallpox, they could immediately have one person shut down a boat from like making landfall and infecting the public. And so this is where the public health officer still has these roles and has this liberty, but it's rarely used. And so the current state of preparedness for Washington is got these 5 basically or 6 domain and capabilities. And there's other capabilities we could add on there, but these are the 6 that the state says we're going to focus on being good at. So we're going to be good at community resilience, incident management, information management, countermeasures, measures and mitigation, surge management, and biosurveillance. So this is the different regions of the state of Washington, and these are the public health regions. And so each public health region has a public health officer. Well, actually, that's not true. The public health officers are by each LHJ or local health jurisdiction. And so, like for Chelan and Douglas County, we have one LHJ. There's a different LHJ for Okanagan and a different one for Grant and a different one for Kittitas. And then each of those LHJs are under one region, and then they get to decide kind of like who kind of leads that for that region. So a healthcare coalition is a group of healthcare organizations, public safety and public health partners joining forces for a common cause to make sure that we can create this structure, that those 6 things that we could do to make sure we're prepared for all hazards. And then we also make sure we do some drills to make sure our plans work. Between when Inslee came on as a new governor, there was some decrease in funding from the federal level for preparedness. And they decided that instead of having 7 healthcare coalitions, they combined all the coalitions into 2. And so we have East Side and West Side. And then later on, they made a 3rd one that's down by Portland because their patient care movement goes down to Portland to the highest level of care is closer in Portland across the river than going all the way back up to Seattle. And so they made a 3rd. So there's 3 healthcare coalitions. And this is a really complicated slide, but I'm just kind of show you that this is how everything's organized from the local level to the federal level. and then emergency management's flow. And so this is really complicated, and I could kind of send it to you later, but I want to just kind of show you what that looks like. So command and coordination. So during a disaster for the hospitals, the state created a DMCC, a Disaster Medical Control Center. And that is a designated hospital within the region or locally, who is going to take the lead to help the other hospitals manage a disaster. So if one hospital is overwhelmed with patients, let's say there's a giant landslide in Chelan, the Chelan hospital is too busy taking care of patients than to manage all the other things that they need help with. And so that's where Confluence is the DMCC for our region. And what they'll do is they have staff dedicated who's going to make phone calls and things to help us move the right patient to the right location at the right time for the right care. Does that make sense? And so there's other things involved with that, but I'm just kind of giving you an example of what that looks like. And so and you're probably sick of all my charts, but I just want to show you their structure and organization of how everyone connects with each other. And it's okay to have multiple people looking at this multiple ways, because I think that gives us a more holistic and gap-filled way to take care of things. Organizations also are like our ICS system. And if you're familiar with ICS, we have incident command. And for the most part, emergency management is that incident command. We have planning and safety, and that is usually our public health organizations. And then we have logistics, which is our healthcare coalition. And then we have operations, which is our DMCC and our engaged partners. So some of the things are like meeting with emergency operations center. This is like, one of probably many fires we've had in Chelan. This is what the EOC looks like. Everyone's at the table. And then there's a lead command. This guy is a Forest Service guy who's like, hey, I'm taking the lead of the fire. Then we have joint information centers where all the organizations come together and have the same message out to the community. So it's nice and clear and clean. This is the EM for Chelan County at the time for one of the fires, and all the Seattle news media. And then right now we have these three healthcare coalitions, and we decided that we are going to reform our healthcare coalition, but we can't call it a coalition. We're going to call it an alliance. And this is what we're currently meeting right now. In fact, we meet later on this week. And this is where I invite the school district or ESD or you guys individually to be part of this. And so basically for Region 7, which is the public health region of Chelan, Douglas, Okanagan, Grant, and Kittitas counties, we have emergency management there, all 12 hospitals, clinics, public health jurisdictions, the LHJs, nursing homes and assisted livings, coroners, funeral homes, EMS, and private and public based organizations. We also have the nursing homes and adult family homes and long-term facilities. So we bring us all together, we go over plans and information, and then we work together to create an agreements. And we actually have assigned like a MOU we can share each other's resources and things like that. So like, hey, if Chelan needs 5 more beds, and because we don't have enough beds for whatever reason, we can activate that MOU during a disaster. So the purpose of that is to approve together plans and resources and logistics, how we're going to communicate with each other, who we're going to communicate with, build relationships, and a place for collaboration. But this is my bacon theory. So there's nothing really better than bacon, right? I mean, like, I just, I mean, then there's bacon and then there's everything else. Like, and so, if my theory on preparedness is, one, you got to be organized, with key stakeholders and decision makers and a way to communicate. Two, you got to build relationships. And in the disasters that we have had, and we've had many in North Central region, and it doesn't matter if you're in Okanagan or in Grant County, or Chelan and Douglas County, we've had multiple disasters every year. It's either fires or something else, even smoke, right? And then recently the pandemic. Relationships matter most. If I call up Mike Dingle and I say, Mike, I need this, he knows who I am. He trusts that I'm gonna, I'm telling the truth, and that he can trust resources to me without having to build that relationship. If without relationships, preparedness is sunk, is what I think. And then all disasters are local. I don't care how big the disaster is, it is always local and it's always needs a local response. And we can't just rely on Big Brother, like Katrina was trying to rely, I think, on the federal government to sweep in and help them, but that's not true. It's all disasters are local and you have to respond locally.
Hey,
So,
Ray,
yeah.
hey, just real quick, I wanted to throw out, and I'm sorry to interrupt, but
No,
those what you talked about, picking up the phone and calling and knowing each other, those handshakes are made, should have been made years ago, and if not, then start them now, because it's critical in the time of need not to get to know the people. You already have it. You have a list of the people. You know their back door number. You call them at 3 o'clock in the morning when you need them, and those aren't done overnight. So, and you were talking about the alliance. I was thinking I would encourage everybody on this Zoom to be a part of that. It's a great organization. I've been involved in it long before it went to 2 and now 3 locally. It's a great group that you can have another handshake with and participate in. So Ray, you might send that link out to get people to join, because you are part of it.
thank you. Thanks, Mike. That's perfect. So I want to kind of just touch on a few resources. We have a lot of resources. Even though we're rural and we don't have a lot of population, we do have a lot of resources. One is we have a comprehensive preparedness response plan. Now, it does need some updates to it. We haven't updated it before COVID, which we're working on as at those meetings. We do have a regional MOU. This is the reason I say this is like a big deal is because, like, I want to say like 20 lawyers were involved in this, like, document that will never happen again. So I'm just letting you know, like, this is a big deal. Like, don't ever change it, because like you're not going to get those lawyers to agree again. And then we have a situational awareness report done every Friday. What's going on? All the data and surveillance of going on, who's having problems, who's not. We have a coordination center for patient placement, and that is on the west side. And this coordinator center is working 24/7, 365. You never know, because things change so quickly nowadays, that a hospital may be overwhelmed in an hour, right? And we also have emergency alert system. I know that Chelan and Douglas County or Chelan County EM is changing. I think they're moving away from AlertSense. They're to another platform. But there's reverse 911. There's ways that we could communicate with the public. Even like doing an alert, the alert sense program could like pick a zip code and say anyone in this zip code, we're going to notify them of a mudslide or something like that. Does that make sense? And then we have virtual communication in place. We have WA Health and WA Track. Both of these are on EMS, fire, and hospitals can communicate their statuses live we can also communicate via text messages and notifications. It even scales up. It'll do a phone call and an email and a text message and however way you want to be contacted like. And then WA Health is a live tracking system. We have redundant communications. We have sat phones, we have ham radios. Some of this came from the 9/11 funds. And then we also have poison control. And I think we don't give poison control enough credit. They can scale up and scale down as a triage center. They can give out public information that can make a call center for the public. Maybe they're looking for their loved one who's missing if we have a giant earthquake. They can basically stand up as a call center and be subject matter experts too. So this poison control is a pretty cool thing for Washington State. And then we have the National Strategic Stockpile, which is a really big deal for doing countermeasures and interventions during a disaster. So I'll just let you know, if we had a nerve agent attack, there's not enough medication in all of Chelan County or Douglas County or Grant County or Okanagan County to probably take care of 20 people. I mean, like, there's just not enough. It takes lots and lots of atropine, and we don't even have 2 PAM. I guarantee you there's not a single hospital in our 12 hospitals to do that. And so just as a FYI, since you guys are schools, I thought I'd throw out that the Washington State has a law that EMS can legally access or basically commandeer school buses for patient transport. So, but the schools are usually really helpful and great, helping us do this, even during drills, but that's just a FYI. Every hospital is given a trailer with decon supplies. So in case there is a chemical attack or radiological attack, with maybe a dirty bomb or things like that, we have the same setup at every single hospital. So it doesn't matter which hospital you work at. If you've been trained at one, you know how to do it everywhere else in the state of Washington. We also have a registry of vetted volunteers called WASERV. That's in addition to what these are for, like, basically retired maybe nurses or doctors that are living in our communities right now who can step up and serve. We also do training and exercise and tabletop functions with our plans to make sure that, these actually work, right? Then I'm going to kind of fast forward, I'm going to get faster here. So you guys, if you have questions, let me know. We also have in Washington State, we have 4 types of shelters. Okay. And so, there's not enough space in every hospital to take care of our whole community during a disaster. So we have to have a plan to shelter people or care for people, in other untraditional ways, right? So Seattle King County can set up an acute medical tier 4, which is basically a mobile hospital. They have already pre-planned, and I've actually participated in 2 drills with King County over on the west side, setting up basically a mobile hospital that can actually do surgery on this not hospital facility. Then we have a tier 3, which is an acute care facility that can surge, but that can't do surgery stuff. And then we have a tier 2, which is a fragile medically need who we can give some interventions, but not as much as a regular hospital. It's a step down. like a clinic most likely, but we can do long-term care there with medications and oxygen. And then tier 1 is basically just a shelter for people who just need a dormitory or a place without medical assistance. And so those are the types of shelters. And for Region 7, we've invested our grant funds all together. We put it all in one pot and created a 125-bed mobile tier 2, basically shelter. So we can place basically nursing home patients here. We can place um, people who need some care and without huge interventions. Like we don't have x-ray or lab, but we do have medications and being able to do some treatment. And so we split this into 5 trailers, actually 7 because of some of the supplies in it, and they're scattered throughout the region. Like this is Okanagan's. And so it says ACF, which is Alternative Care Facility Region 7. We have, and this is what they kind of look like. And we've set these up multiple times in every county. This is one picture at the Town Toyota Center. Here's another picture of where we set up a 125 bed, basically hospital here, and we practiced. Red Cross, Red Cross in our region has not been as robust as they have in the past. And I think they're struggling being able to do shelters. Just the other day, I asked them for a shelter from the cold weather. Remember, we had that big cold streak? We had a power outage in Manson. And so I started activating our system of preparedness. And I'm like, let's do that. We got what if the power is out for 3,000 people in Manson and they're not going to have it for over 24 hours? We need to create a shelter for them. And Red Cross said we could do one for 24 hours, but that's it. And so like there's some risk here, but we either need to help Red Cross or we need to do something else. We also have triage tools to where we send people to either the alternate care facility like the Town Toyota Center or home, or to a Red Cross shelter or to the hospital. So we could bring the sickest people to the hospital, the less sicker to the like Town Toyota Center. We also have the ability to have a federal medical station, which is a 250 bed tier 1 facility. This is an example of what that looks like. We've set this up on it, and my gosh, where's the big place in Seattle that the state fair is at? I want to sell it. And anyway, we set it up there before. I've been part of that, and it's pretty complicated, but there's only 3 of them in the whole nation, so likelihood of us getting one, unless we're the only ones with an earthquake or something, is little. So this is now where we're going to get to the meats of this. This is where I think I need your engagement and hear from you about how you are probably a huge gap that can be filled in our system. And so I think we totally need you. So here's my thoughts, and I'm going to kind of just put out a couple slides, and then I'm going to open up for discussion. I think you, the school nurses, have a unique understanding of the disease status in our community. And so one of the reasons is at least 27% of the population in the United States is in school at right now. So like students or employees, 27% of the population at least. It could be as high as 33%. It's not really an accurate number of how many schools employ additional people like who are on campus. Does that make sense? And I only know like how many teachers there are and how many students there are. I don't know how many janitors you have or other people that you have. And so that is a huge part of our population. There's not another single industry that has that type of population live at that location. So you are really seeing like 1/3 of the population at all times. That is a unique understanding of the wellness of our community. I bet you guys see probably years before the hospital or a clinic or a physician can see the long, like what's going on acutely with illnesses or chronically with like maybe childhood diabetes or obesity, or I can keep on going on. You also have relationships. And remember, one of my bacon moments is like you got to have relationships with students and families to deliver education and interventions. Super unique, super important. There's not, I mean, there's primary care that has some of those relationships, but you probably have a more robust way and more relationships than they do. I think you are super school nurses. I think you guys have your finger on the pulse. Like EMS, we only see the acute when people are so sick they want to call 911 versus driving themselves or something else. I think you guys see the population, 1/3 of the US population at all times. You are the finger on the pulse. You know when that pulse is going faster or worse or bad or good and I think you see social, economical, physical, and mental health of the community, and we should be taking the status of the health of our community from you. I think you are super surveillance for our community. That's what I think you are. And um, so one of the things about surveillance, talking about that, I want to like kind of go over is there's two plans for surveillance. Well, actually, I'm not even going to go there. I'm going to stop right here. And I'm going to ask you guys, am I off track? Am I on track? What do you guys think? I can't see everyone, so you're going to have to either just jump on or.
Ray, we have a few people in the chat that are saying um, on track, on track, on track, definitely on track. Yes, on track.
What is there a role that we're missing for you? Like you think you're underutilized in this way. What way is that?
They're probably typing. Hang on just a second. We did have a note from Anne Benedum that we see upticks in COVID.
Probably faster than we do.
It's possible, yeah, absolutely. Would you mind repeating your question for us?
Sure. What ways are you guys underutilized? That's question number one. What ways are you underutilized, or what ways do you think you need to be involved more, or how you can be used for preparedness for our community, or maybe just normal health of the community?
Ray, one question I had was a couple of slides back on WASERV. Is that what we used to um, sign up to help with COVID testing in the community or giving COVID immunizations? Because I remember I signed up to help and I did give COVID shots and helped with the local COVID testing in my area before I moved here, but I don't remember going through the registry of volunteers. Is there another way for people to sign up and help in that way?
So yes, so you could do two things. You could go to WASERV and you could just type in your Google search Washington State Emergency Registry of Volunteers, and it'll take you to this, and then you could register, and it'll ask you questions and upload information. It'll do a background check and vet you. There's another way, and I'm gonna probably, I don't want you to inundate emergency management, but emergency management can also make you an emergency worker, and they have their own process too to vet you and give you basically a card to be an emergency worker. And so those are two ways. This is the easier way, because public health will have access to this. So if a hospital needs help, public health can go into this registry and pull up your name, and then they can make phone calls to come and say, hey, are you willing to come do mass vaccinations or something like that?
Gotcha. Well, we do have a few comments in the chat. One from Kathy: school nurses may not be included at the table when health and emergency decisions are being made by the district.
That is a good point. And that's where I think you guys at the table at the Region 7 Healthcare Alliance can help with that. I'm just making a note myself.
So we had another question from a new school nurse asking about the joint meeting that you mentioned later this week. I think it's the Regional Healthcare Alliance meeting.
Mhm.
Is that going to be recorded?
I don't think they're currently recorded, but I can ask Public Health if that's something they'll do.
Okay.
I don't know. Sometimes we talk about plans together that we don't want that information to the people who are mischievous.
Gotcha. Okay. So another nurse had a comment, Amber. If you want to know what's going through our community, send us an email and ask. They do have a lot on their plate currently, so maybe incorporating them in another meeting or something might be a little bit more of a burden than can really be handled.
Copy.
Something similar from Ben, who says many districts have limited hours and therefore nurses cannot be utilized for extra when we can barely cover what we have, which is an excellent point. We have another comment, Sarah. I think your question about us being underutilized is a good one. However, I don't have a good answer. I agree with Amber. We have a pulse on the community. However, we have limited time to do any more. Excellent, thanks.
So we have a capacity issue with you guys, even though you're in the right spot at the right location. We need more support and maybe more of you or more funding. And then we need to figure out a way that we can ask you guys questions like, hey, we're seeing an uptake of RSV in our clinics. What's going on with you guys and how we can do interventions together, maybe, huh? And I don't know. I don't know how to make this structure, but I'm willing to take this information to the alliance and say, how do we make this a role? How do we support more? Maybe we even go to the state and say, you need to really, if you care about public health, you need to put some money to this,
I think that's an excellent point. Kathy also mentioned in the chat that EMS and EM champions requesting school nurse involvement could increase voice. And a lot of it does come down to not just the nurse being in the building because we are there, but it's the time that we have to accomplish all of the tasks in the building. if that makes sense. So
Yeah. You need more capacity, right? Yeah. So just a side note, for reporting, you guys have a infectious disease control guide on when you report what and how. And I looked at that over the last week. And then the rest of healthcare has a different reporting factor. And this is the one on the left-hand side. I'm wondering why they're not dovetailed in my mind. But I'm gonna kind of ask that question to public health, and maybe the public health officers can kind of like maybe navigate that. How comfortable do you guys feel about reporting? Like, I'm assuming you guys know what this document is on the right-hand side. Um, this is 2014. Are you guys comfortable with that? Do you guys like, oh yeah, I use it all the time. I don't use it. This is even a tool. Okay, Amber, you says you use it. I found a chat button. Thanks. uh, good. Quincy uses it. Okay. I use it a lot. I use it. Good. Good. It good. Okay. I just want to know, sometimes they make tools that are stupid. You know what I mean? Like they're not usable, I don't know. So I'm glad that it's do you feel like there's you guys get feedback, or if you report, you get feedback on like what's happened or what their plan is, or do you feel like it's going into a black hole and it's never seen again and you don't know what happened? It depends. Okay. And it could depend if it's something that's really kind of private for the family and they want to respect.
Sorry, I was talking and I didn't realize I was on mute, but I don't really use it to report. Um, I don't really have a lot that I need to report on, but it's a lot of times just for like remembering the guidelines and making sure that I'm lining up with, like, hey, you've got to be out for this, or no, you don't need to be out for this, and using it as a backup with parents, like, hey, they can still be in school for this, as long as it's covered, or they can, no, they have to be out for X amount of days. And it's kind of like my backup support for parents who are giving me pushback or the other way around.
Okay. Thank you, Amber. Thank you for that feedback. Are you guys feel similar to what Amber said?
I can say that I same as Amber. I use that infectious control guide as backup, kind of like I know pretty sure on most of those things what needs to happen, but it's backup for when you get pushback from staff or from families. And that also, I just wanted to say that reporting is kind of like there's still shell shock attached to that with the COVID. It became so cumbersome that it consumed when the COVID was really at its high point, it consumed the hours to the point where you weren't even taking care of people. You were just reporting. It was super cumbersome.
Yes. I heard that too. I don't know if that was ever included in an AAR, which I'm going to write a note down. Yeah. Well, it was the same way with hospitals too, but we had more staff than just one nurse. You know what I'm saying? Right? Like most of you guys do. All right. Any other thoughts before I kind of move on about reporting piece? Maybe I could give feedback to public health, or kind of up the state to have a better plan next time, or something like that. Any thoughts? Any other thoughts?
Ray, I had someone email me a question who wasn't going to be here today, or will at least watch later on. She asked about having some support and getting the COVID guidelines changed, because we're still under the same COVID guidance as we were a year ago.
Oh,
So if you want to
interesting.
put that plug in too, that'd be great.
What county is she in? Because it might depend on that LHJ.
Chelan, I think. Yeah.
All right, I can give. Um, I'll give that feedback. All right, and I think Kathy put in a printable poster. So I kind of probably asked this already, but like what is the best way to use you guys for preparedness? Is it with parents and child to be a big influencer, a bridge builder? Should we have a better reporting system? Maybe. From you guys to you guys. Sounds like there's not enough time for you guys to do the work. You're doing operations and you can't do reporting or planning. And if you had to pick one superpower, I know these are multiple questions, but if you had to pick one superpower that we need to maximize for preparedness, what would it be? We can only use you one way. Is it operations? How would you feel like you need to be used? Maybe you don't know right now and you have to think about it, and that's okay too. But I do want to ask this question because like phone calls and parent education is one in the chat. That's awesome. Yeah, since they know who you are when you call them versus some stranger. Reporting from the LHJ could be delayed. A lot of times our students are off quarantine before we are notified, and we have a lot of parents that will refuse to tell us why their student is out. Getting communication out to families. Identifying health-related liaison for school district. Kathy, can you explain more on that one?
Yes, I really think that the school nurse is really the health liaison when information's either coming out or going into a school district. And it's really important that they be identified in that role, as opposed to information kind of coming in through different sources related to health. There really should be, when you're talking about the communication tree, for example, of how does health-related information get into or out of the school district. And I really think your school nurses are that key liaison role to know what's happening in the school and how to distribute information well to parents and staff within the school about health-related issues.
This is great. This is great information because I wouldn't pick this one as your first superpower. But I was always thinking of you guys like, oh, you could be the intervention. You could do like mass vaccinations. You can do all, but I see that that's not it. I think maybe that relationship is your superpower. This is good. Thank you. If you have more thoughts, I know we're running short on time, so I want to make sure that I do get your thoughts. But if you have more thoughts, or maybe if you're listening to this on as it's recorded, and you feel like there is one thing that we need to maximize, will you please tell Lene or Kathy so we can get this information and start building a plan, a better plan. I also kind of want to let you guys know there is a AED registry, and there's a regional one. So under the state law, under RCW said, and I'm not going to repeat the numbers for you because that's ridiculous, but um, what is that if you have an AED and a public uses it, they're not under the Good Samaritan law unless that AED is registered. So that means if something goes bad, um, there could be lawyers involved for a civil or criminal lawsuit, right? And so that's bad, right? That's the Good Samaritan law is protecting people in good faith to caring for another person, right? And so for AEDs to have that same Good Samaritan law, they need to be registered. And so the regional registry for all of Chelan, Douglas, Okanagan, Grant, and Kittitas counties is through the local council, and I am the chair of this council. And so I hold the regional registry, and I'll kind of show you. I don't know, hopefully this, I don't know if this will work. I don't know if it'll pull up. Oh, so let me stop my share and share. This is what it this is where all the AEDs are registered look like. And so there's probably more AEDs than that's located here. Now, the ones that are not on here that are registered are some of the AEDs in police vehicles. But these are all the located AEDs, these red spots, through our region. Now, I'm still in process because dispatch is not, is still growing and it's robust operations. I'm still in process of getting these on all the dispatch centers. So for Okanagan Dispatch, Rivercom, and Kitcom and MAC, so they know where those are at. But just let you know that's the process for this registry is for that. So I'll stop and share. If you guys need to know, or if maybe your school has AEDs, to make sure they're registered, just go back and you can request the documents, or you can get them off of a website that I didn't put on here that I should have. It's the regional council, EMS council website, and it's ncecc.org, ncecc.org. And they have the paperwork on there, or you could just email me basically at greaterranchemscouncil@gmail.com, and I will send you the packet for that. So just as an FYI. Any other questions, thoughts? This is my team kind of during COVID. This is where we did vaccines up in Holden Village and Stehekin with the piles of snow. If you haven't seen Holden Village before, it's way up in the mountains. And this is when we were doing up on the right-hand side is when you're doing vaccines for kids in a drive-through. So
Ray, this is Amber at Cashmere again. So we have AEDs, but they are not always we have several, but they're not always in the same location. Like
yeah,
during, springtime, we have an AED that's in the track shed to be used between like tennis and track for track meets, and one, that is in the softball shed that can be used in the springtime for, and then they're using, but in fall for football and what, you know what I mean? But like in the wintertime when there's not those sports going on, they go back and they're kept in the high school. So like how would that work on that registry?
I would just put it as it could be moved to variable locations, but its primary ownership location is this address, right? And that's where I would just put it until then. I mean, it would be great to like, and I think in the future we'll have like geo trackers, like so we know exactly where they're at from dispatch or something like that. That
Mhm.
would be, the future. But right now we would just the normal, I would say like if it's 50% of the time at that location or 51% of the time at that one location, maybe you put that. That's what I would do.
And also, so you said like open to the public, like, so ours are like locked up unless there's an event going on or like practices or an event, and otherwise they're locked up. So, or locked in the school. So it's not necessarily
Accessible.
they're not necessarily accessible all the time.
Yeah. Not all businesses, like we have banks who have AEDs, right? I mean,
Sure.
they're only open during bank hours. In the registry, we ask times of availability. And so, we'll hopefully have that info tied into the dispatch center. So when they look at the map, they can see only available between this time and that time. Does that make sense?
Yes, thank you.
Ray, this is Kathy. Just a quick question on the registry. Is it possible, besides the address, to include the specific building?
Yeah,
Or-
it,
or the-
it has that, like
Okay,
there's a lot of kind of data points that where we ask in it. Yeah.
okay. Thank you.
Any other thoughts? All right. Thank you guys for your time, and hopefully I know that the front part might be a little bit redundant or not very engaging, but I hope we can do better. But we need you guys.
Thank you so much for being with us, Ray. It was a wealth of information, and we're appreciative of your time and your questions. So thank you for being interested in partnering with us and keeping the students in our communities safe. So again, if you have any questions that you think of for Ray later on, please feel free to email Kathy or I, and we can pass those on to Ray. He did have his information in that last slide about the AEDs. So, and we will make sure that his information is available after the meeting is over for you as well. So again, thank you for joining us, Ray. We are going to move right into hearing from Mike Dingle from our student safety consultant here at the ESD. So that way we can take this big picture of emergency preparedness and safety and move it a little bit further down into the building itself. So Mike, go right ahead and share with us your information about safety in the
Lena,
buildings.
do you think we need to take just a couple minute break? People need, or not. Sheila's saying no. Okay. Well, I listen. So, okay. Well, thank you all. Mike Dingle. For those who do not know me, I am the student safety consultant here at the ESD. Statewide, my position is the comprehensive school safety coordinator. And that's deemed by OSPI. But when I was hired into the ESD in employee safety, the worker comp piece. But with my background, there were superintendents that were looking for a crisis type program. So I initiated that many years ago. So a little bit of my background is I followed my dad's footsteps. Although he was a local business owner, he did spend a lot of time in emergency responder worlds. So I've worked a fire truck. I've worked the back of an ambulance. So I've been in that realm as well. I'm a retired law enforcement sergeant with the State Patrol after 26 years. I run emergency management for Douglas County. I've run around the country teaching hazardous materials, ammonia specific. And that's far too many years. I've turned gray over those years. And yes, Ray, when the earth started to cool, thank you. I do recall that comment. And you'll get there. So, but yeah, I've been basically lived in the first responder world for 50 years of my life. So it doesn't mean I know everything by any means. And as soon as you think you do, somebody will quickly tell you you don't and such. So I had done a presentation to our home visitors, you know, what to look for, you know, while out of a school setting. You know, and the slip, trip, fall world, or animals, or drugs, or guns, or whatever. And Lena had asked if I was going to put a PowerPoint presentation together, and I said no. It's more of I'm thinking more of a discussion base. So please feel free to chime in and ask questions. But I will tell you that my talking points that I have been scribbled on completely, and my PowerPoint presentation that I would have done, I'd have thrown out before we even started this, because I think that there's more, you know, some things. And you tell me, how many of you are working outside of your district buildings and going to homes? Because that will help guide me towards, you know, my discussion today. I can certainly talk about some of those ideas, but I'm guessing that the majority of us are, you know, situated in a building. Is that accurate? Don't be afraid. Just hop off mute and holler. Okay. Blanca goes to homes. Getting another email. I do one per school year. Okay, Amber does not. So it's I'm going to do a little bit of a hybrid. But let me go into what I was originally some of the things that I wanted to say. And you know, first of all, what is an emergency? An emergency is an event that is either out of your control or beyond your control. And that can be at school, that could be in your car, that can be at home. You know, an emergency is just that. And the one comment I have is it happens whenever it decides to happen. It's not at crossing time or you know, crossing periods. It's not at lunchtime. It's not when it's convenient for us. And so we have to be prepared for emergencies at all times. And Washington State law, RCW 28A.320.125 is a safe schools law that you may want to pull up. Again, it's 28A.320.125. And it talks about emergency preparedness in our buildings. And, you know, I'm not here to put additional work on you. I'm asking you to talk with administrators to see where they are, because you are a vital part of this. And those who know me, I hate the term drill. You know, we drill to this, you know, we drill to an earthquake, we drill to a fire. Well, we just drill to a drill. Oh, are you kidding me? We have to go outside again. It's raining, it's cold. You know, I've got better things to do. I got to teach my kids this and that and such. But so we just drill to a drill. It's very important for us to hold ourselves, our peers, and our kids accountable to train in the way that, you know, that we need to, because it's proven that if we train haphazardly, that's how we're going to respond. So let's make sure that we are exercising. I say exercise to an emergency. Don't drill to a drill. Exercise to an emergency. And too many times I've been in buildings and I'll come in, you know, and do exercises within buildings and such, and it's just nonchalant. It's just no big deal. Just a very short story. We had done an earthquake with a reunification exercise in a district, and you know, the event was going on. We were moving over to start a reunification. A child had gone and gotten his lunch out of his locker and was munching on a sandwich when he went across the crosswalk. Wrong move. The principal was there and absolutely, in a respectful way, ripped this kid and said, "You will never go to your locker to get your lunch. You will, do the proper way to exercise." And I thanked him afterwards because that was holding his kid accountable. We need to do more of that. So again, there are several exercises, and state law calls them drills, which I don't like, but that are mandated by law. And it changed several years ago. The legislature used to say you had to do 3 fire drill and 2 shelter in place and that's changed. You now have to do a minimum of 1 fire lockdown. I'll talk more about lockdown, shelter in place. I'll talk more about that, an earthquake in our area. So fire, lockdown, shelter in place, and emergency. Now you're required an exercise once a month in each of our school buildings that have kids and such. So beyond that, the law has now given our administrators the authority to decide what needs does our building have, and we can exercise those more. And think outside the box. What major earthquake is not going to have a fire attached to it? So combine them. I was looking earlier to call out Liz Prey, and I didn't see her on here. If she is, raise your hand real quick. And I'm not calling Liz out in a bad way. I'm calling her out in a great way, because she has done several medical emergency exercises down at Moses Lake in several of the different buildings. And, we talked about AED. Ray talked about AED. They have a specific location for their AEDs within the building. And they may have more, but there's at least one located at a certain point in the gym. So all staff know where to go to get the AED. They aren't looking for it. They simply know where to do it, and they exercise it. Their exercises are a functional exercise with their local EMS, their fire department and law enforcement. She does a fantastic job with it. And again, we have to do the 4 that I mentioned, but then we can think outside the box. A medical emergency can be one of those. It can be a heart attack with the AED. It can be asthma attack. It can be whatever medical emergency you guys want to bring into bring to the mix. And I don't know that you knew that.
Mike, I'm sorry to interrupt you. One of the best things that ever happened to me was a fire drill that was accidentally conducted during lunch.
Mm-hmm.
No one had ever scheduled a fire drill during lunch or a recess. And that was very, very eye-opening too. So as you're talking about conducting different drills or looking about where our gaps might be in our preparedness for such events, that was a very eye-opening thing to me. And I thought I would just throw that out there to our nurses, that it was super inconvenient, but doing a fire drill during lunch with a bunch of kinders and first graders trying to eat was really great for our school to learn.
100%. I lived through a major house fire in my youth. So and then who would have thought that I'd go into a first responder world, for careers. But, it still hits home with me, crawling out a little tiny balcony onto a roof down to get to safety as the house, the whole upstairs, the whole stairwell was fully engulfed. And that was the only way out. And Lena, thank you again. It is vital because emergencies happen whenever. We had a district recently that had a swatting event, a bomb scare, and they it was a late start, so there were not students on campuses yet, but they did a great job in recognizing and such and working with parents and such ahead of time to say, don't come to the building today and such. Social media has taken such a high priority. If you don't get in front of social media, you're going to always be behind it. And so that's really, really critical. Again, the medical emergency, talk to your administrator and say, hey, I'd like to put one together. And it might, it can be a student that's hurt on maybe on a playground. Better yet, I really, as much as I don't, there's a law for the lockdown that we cannot use kids in a lockdown exercise. And that stemmed from a particular company that did training that, basically scared the heck out of the kids. I'd love to sit down with a bunch of kindergartners or first graders, sit in the floor in a round circle and talk to them about what an emergency is, so that when the intercom goes off or the fire alarm goes off, they understand what's going on around them. These kids are smart and they can absorb that, but you have to teach them in such a way that it makes sense to them. So it's as much as we practice, I'm going to tell you, we're going to have chaos. Doesn't matter how much practice we do. We're always going to have chaos. In an educational setting, they are there not as a first responder, although they have to be anymore, but they are there for, they're educators, and that's the world, that's their training. That's the area that they've worked in. And like you say, they really shouldn't have to be first responders. I had a superintendent tell me, I'm thankful because I'm back to one job, being a superintendent. And I looked at him and I said, can you explain that? And he goes, well, I'm not the one dealing with COVID anymore, because COVID is over, and the amount of work that brought on to the districts and yourselves and such was absolutely incredible. And it changed every 20 minutes, it seemed like, and you had to be on top of it. So I will tell you, thank you right now for all of your efforts over these past many years and years prior and to come, because your positions are very vital. Working with the Alliance, I think, would be awesome. Especially with my emergency management background, rather, knowing those handshakes, those connections, knowing who to go to, and you are part of that. So I think that's vital. Ray alluded to the fact that we had a local healthcare coalition many years ago, until the state decided to move it to 2 and then 3. It was awesome. And when they combined it, things didn't work as well. I'm not gonna, talk, say things that I shouldn't and won't, but I'm really wonderful that we're kind of looking at a local alliance again. And again, you guys really are a part of that.
Mike,
So yes.
quick question for you.
Absolutely.
So Ray had talked about the emergency procedures, and you and I had recently worked on or discussed our local annex for our ESD. Would you be able to give some insight as to what nurses can expect in their emergency operation procedure annexes for their districts? And I know I'm calling it the wrong thing.
That's
So
okay.
could you give them the right
No,
language and what they
it's a
might
great
expect in
segue.
seeing that?
Yeah, it's a great segue, Lena, because that's just where I was headed. Every district through that Safe Schools plan is required to have an emergency operation plan. And some of them are very extensive. Some of them are not. Some of them have been updated within the last year. Most have not. And they really should be. But you can write a 2-inch manual, 3-inch manual to sit on a shelf. But push come to shove during an emergency, that's not what you're going to go to. So you may have an emergency operation plan that you should, if you haven't seen it, should look for it and read it. because, and I hate the term, it's, you know, it's really the kind of the security Bible. I don't like to put it in that fashion, but that in all essence, that's the main document you go to. So it's vital. I have written one for our ESD specifically that sits on our superintendent's office, and I'm told that it's going to be, you know, spread out to all staff at some point, but it hasn't yet. So what you're talking about are what I affectionately call, or, you know, FEMA and such, functional annexes. And there's many of them that have been written that I wrote in conjunction with the majority of superintendents up north in our Okanagan area, that the majority of our districts have adopted and such. But these annexes, and whether it's earthquake or it's a medical emergency or it's a pandemic, which your buildings all have an accident prevention plan. Take a look at that document as well. It probably too needs to be looked at. It was updated several years ago, but that, you know, that the pandemic information is in that accident prevention plan, and all districts have them. I know that because I was very involved with getting them out to districts and such. So, but it can be student threats, which is a huge, huge topic of today. We are not the coastline, those districts that are on the coast are required tsunami exercises and such like that. We are not here. We're not in a tsunami area, but maybe we should be. The reason I say that is if Mica Dam in Canada, which was built as a support to Grand Coulee Dam, it's an earthen dam. It's a mile wide at the base of that, and it's dirt. If that fails, we have a wall. It goes over two other dams. It hits the Washington-Canadian border with a wall of water 67.5 feet tall. Where is that water going to go? And many years ago, I was involved with a federal exercise at Grand Coulee, and they were flying all these people into Grand Coulee for this Mica Dam failure, and, you know, to work it. And I was new into emergency management. I raised my hand and I said, "What do you guys think you're doing?" And they looked at me like I was just stupid. I said, "You've got a wall of water 15 miles north of you coming down a channel, and where's that water going to go? And you've put all these people, smart people, into Grand Coulee Dam. It's overtopping the dam and killing everybody you're putting in there. And then Dry Falls is wet falls. Moses Lake's underwater. Palisades is underwater. Quincy's underwater. A lot of Wenatchee's underwater and such." And they just realized, wait a minute. And there's not what they call an inundation map for those dams that are up in Canada. There is for Grand Coulee and Chief Joe. But so there's a lot of work there to be done. So I'll get off my high horse on that. So I want to show, see if I can share my screen. Here's a document that I've sent, updated and sent prior to the school year on required exercises for each of our districts in the state. And again, it talks exactly about those 4 that are required, and then talk about other ideas. And I've done it per month in a way that it makes sense weather-wise. You know, I don't know that I want to put kids out, you know, in a fire drill in the middle of January or February when it's -9 degrees out, as it was at my house. That's not safe. But in reality, if that's what we needed to do, we would. So this document has gone out and given them some ideas and such. I've asked several districts to send me their calendars for exercises or drills, and I've received some, and I try to get out to them, as many of them as I can. So let me stop that one. Let's see, share screen again. So here's a document that I've written and recently updated just prior to the beginning of the year, and I included the communications piece with families. Piece is so important, and I have them for probably 15 to 18 different emergency type events and such. So lockdown is lockdown. It's an internal intruder situation, and it doesn't have to be a gun. I can do the same thing a gun can do with this pen, wherever the camera is, or a fire extinguisher, or an edged weapon, or whatever. You know, lockdown is just that. It's for the highest level of emergency that we have within our school building. And a lot of times, I saw one not too long ago where a dispatch center called a district and say, go into lockdown. So that's what they do. They don't ask questions. Well, this was a situation that was close to a school, involved a search warrant, a high profile search warrant, that really they didn't need to go to a lockdown. What they needed to do was go to a secure the building. Please, if you hear lockdown, it's always worst case scenario. If you hear lockout or modified lockout or soft lockdown or all of these other terms, do me a favor and say, no, we're not using lockdown, lockout. Why? Because they are so close in verbiage that when it goes over the intercom and the teacher's teaching and involved in that, they look at, you know, their ear turns to the intercom and they say, to the students, was that a lockdown or is it a lockout? And half of them say, one, and the others half say the other. The verbiage is so close, it's not good. So I'm trying to do my best to say lockdown is worst case scenario, and then secure the building. You may also hear secure and teach, but I like secure the building because that's exactly what we're doing. We're securing the perimeter of the building. We're putting staff on the doors to get kids off of playgrounds and staff off of playgrounds. Don't let people in that you're not aware of. Don't let people out and such like that into harm's way and such. If you don't know the people, gosh, they're just not going to be invited into our buildings. So that's really critical. Shelter in place. I call them chemical emergencies. Why? Because chemical emergencies can happen on the outside of a building, or they can happen on the inside of the building. And most districts don't think about shelter in place. They just say shelter in place. That's for a chemical emergency on the outside of the building where you shut your maintenance staff and such should be on that immediately, shutting down your HVAC or at least the fresh air intake. If you can separate those, doesn't mean you have to shut the whole system down. Just stop inviting that air from outside in that it's bad for us. Many years ago, I read a shelter-in-place plan that was specified to put everybody into a gym. Yet they couldn't track the carbon dioxide level, and that can be very dangerous. So they put a whole school full of kids and staff into a gym that they can't track the carbon dioxide. That's not good. So in this one particular plan, I got everybody convinced, just go about your business. You can secure your building if you need to tape it and such like that, tape the doors, tape the windows and such like that, the vents, shut down the HVAC, or cover the fresh air intakes and such like that, where they enter into the building itself, not from the outside. That they need to get that done, right now. We've got districts that have a huge amount of ammonia, and the only thing between them and the playground is a cyclone fence. And I know somebody's looking at me saying, I know exactly who it is, and I'm not going to point it out, but that's a real concern, especially with that chemical, because ammonia shuts down Your lungs, you can't stop it. You stop breathing. You will shut your eyes. It's a natural thing. You can't see and such, and it will do harm. Anhydrous ammonia, the Latin part is anhydrous, which is without water. It wants water more than it wants anything. It will fight the wind to get to water, whether it's on you, in your pits and other areas, or in your lungs, because of how much moisture we have in our lungs, and it can hurt, it can kill. So we have to be prepared for that. So, I'm showing you the lockdown functional annex right now, and it's broken up by positions. So the first column, which I like this way, excuse me, is for our parent, or our teachers or our paras that may be working with kids. It's very transparent. The next column is for the principal or designee. The last column, or the third column now, is for the superintendent and designee. And it's meant so that everybody can look and say, okay, I don't need to worry about this function because that's the job of the superintendent and or designee. But it's a tool. Can you deviate from it and as required? Absolutely. But one of the worst things we can do is make these tools, put them in our toolkit, but not train to them. And I know that has happened in some of our districts where they have spent a lot of money. They printed these, put them on a flip chart thing. They're by the door of the classrooms or offices and such, but they don't train our staff to how to react to them. And they've had situations that just did not go well because they had the tools, but they didn't train to them. So having that piece. So my question to you is, do you participate in your exercises? Regardless of what they are. And sometimes it's hard. I understand, because you've got, I'm trying to get to, my computer is not cooperating with me. There we go. But if you're working with a child that's sick, and you have a fire exercise, or you have an earthquake exercise, how do you deal with that sick child? Do you take them out? Do you not? What about medications? Are you prepared if you have to reunify to grab medications? Are you even taking an AED or a large first aid kit out to your reunification site or and such? If not, can put that in your plan, because you may not have the access to get back into the building to get that. If you can safely, grab your keys, grab a coat, but don't delay to do it, because you may not be, especially in a lockdown situation where it may be a criminal event, that school is going to be locked down. It's for evidence. You may not get in there for a very long period of time. So think about that. If heavy on the if you can do it safely without delay, go ahead and grab that. And saying, I'm the person in charge of running these exercises. Thank you for doing that. Thank you for the term exercise, number one. But again, these are critical. Don't be afraid to hold people accountable to do it right. And that goes staff, that goes kids. I'll tell you, the worst group there is that want to participate in an exercise, especially the monthly exercises, is our food service. Why is that? They can't shut off the stove. Yeah, they can. They must, because they may not know. It's, you shouldn't have to say, this is a drill, or this is a real event. We have a situation, it's a real event, and such. So everybody needs to get into the pattern of working and participating in these exercises. Yes, I know it's hard. I'm asking for a lot, but I'm also asking for your personal safety down the road, because again, how we train is how we're going to react. So that's kind of my bandwidth, what I'm thinking with talking about those exercises and such. But I want to, just talk a little bit more about some of the safety presentations, especially or the home visitor presentations, because we do have some that are out there, and what I want to say is be prepared. Don't be paranoid. You don't have to be paranoid, but you do have to be prepared. If you're going out for a home visit, let people know where you're going. You have their telephone number. Make sure they have your number, that they might check on you. Especially, I've got a comment here that, to treat all the different locations the same. Shady homes may be great, where to the typical or upscale homes may have the issues. You think of the some of the homes that we may look at and say, I don't know if I want to go in there. They may be drug houses. They may not. They may, it may not be painted, but the next door neighbor just painted theirs, and theirs is the worst one. So again, treat all locations the same as you're walking up to them. Be cautious of our slip, trip, falls. That's getting into our workers' comp piece. In the winter months, check out some yak tracks, or those foot devices, so you don't slip and fall, because as somebody had mentioned earlier, there's not a lot of you, and if you're spreading your distance around several districts and you're out, you're not helping anybody. So take the time to protect yourself, because we don't want you falling. That's the last thing we want. So make sure that you're wearing the proper shoes, that are for the seasons. Careful of potholes and uneven ground, steps that may be broken, or handrails that are loose. Try to stay in lighted areas the best you can. Watch for shrubs and trees. There's a term for that. How to trim up trees and trim down bushes so that people can't hide and attack. And that can be right there at your own school. The term is septed. And but again, we need to make sure that the lighting's proper, that things are such that people can't hide. And we've had some people that are some staff that say, I'm not comfortable going out of my building when it's dark and there's nobody else around and such. It's always best to do that in pairs and such like that. So keep in mind your own personal safety. Animals, treat all unknown animals as, they could be aggressive. That can be on the playground, for heaven's sakes. If you have an animal, an aggressive type animal, you don't have to call a lockdown. You call a secure the building within the building. And don't be afraid, check with your administrator. Are you the one that can call that if you see it? Or does it have to go through them? I would hope they would say anybody can call it. So know how to use your intercom system and set that emergency up so people can get in safely as quickly as possible. If you have, you're out, make sure that the clients are greeting you and inviting you in rather than just, walking in. You may have built rapport with your parents and such, okay, I expect you at 10:30, you're here at 10:30, just come on in. I would recommend that you don't do that. Always make sure that they invite you into their home. And when you're there, try to position yourself in a safe means. And this is also, and I have another note here, this can be in your own office. Try to put your desk in a location where you have at least 2 exits, that you're not blocked into getting out only in one way. If somebody gets in a fighting type mode or whatever, that you don't trap yourself in. Don't block the view of those that you're working with your displays, your computer displays and such. And that may be difficult depending on the setup of the room. But again, I think it's really crucial that you have at least, you can move to the left, you can move to the right to get out. Don't block yourself. Be cautious, in your home. Look, keep a open eye. And this also goes for our buildings. I have what they call a 30-second video that's awesome, where a gal comes in, she's very argumentative with the front office staff, and all of a sudden she displays a knife. And what are you going to do? And how are you going to back away? You never go towards an aggressor, you always back away from an aggressor. And that's, again, part of how you position your office and such like that. And that can be difficult because we don't want to put you in harm's way. But weapons can be, again, multiple type things. It can be a kitchen item, knives or guns and such. Look at your surroundings. Is something on the table that you're uncomfortable with? Move away from it and such. Be aware of the surrounding and listen. Are there other people in the home? Are they upstairs, downstairs, room next door? That may have an interest in while you're there, but really shouldn't necessarily, and then become argumentative, with parents or with you and such. And how does that look? So just keep that open ear, listen, feel the hair on the back of the neck. If you feel the hair on the back of the neck, stand up, listen to it. I can't tell you how many times I did that with my law enforcement career, and it always, 100% of the time, served me well to do that. Again, I talked about phones. Make sure that people are aware of where you are, that you have people to call. If you need to call 911, call 911. Period. But have that communications between you and your staff or your administration and such. If you get into a situation that's going bad and you have to call, don't hang up. Keep that phone live so that they can hear what's going on and they can try to talk to you. If that other person needs to call 911, pick up another phone and call and say, hey, Lane is here. I know she's in peril. Let's get some help rolling that way. But if you hang up that phone, you've lost that contact, and the likelihood of you're going to get that connection back is pretty slim, especially during an emergency. Keep a current list of your visitor locations. Again, where are you going specifically? So, and a lot of this is just common sense. Listen to the tone of those that you're working with, whether it's a child in your nurse's room that is, ramping up, or listen to the tone because maybe all of a sudden their blood sugars are dropping, and you can tell. I mean, you're trained. You can tell by sound of how is that person doing, or are they ramping up and going the opposite direction? And getting, quickly to be aggressive with you. So there's the tone of people. Drugs, especially in the home visitor setting, be cautious of drugs, or, what's on the wall? What kind of paintings are on the wall? Are they promoting, drug usage and stuff? I've been in some homes where are you kidding me that they have that? But I lived a little different lifestyle than they did, fortunately for me. But so be careful, cautious of the pills and the needles and baggies. If you're glassware, razor blades, butane lighters, etc., are vape pens that can blow up because the lithium battery explodes. On and on and on. So a lot of discussion there. And fentanyl, and carfentanil, which is 100 times more powerful than fentanyl. What about carrying naloxone? I work with our SROs and our SSOs our SROs are commissioned law enforcement in our buildings. Our SSOs are not. They are school staff. I encourage all of them to carry Narcan or naloxone on their body. If and some, it could be for themselves if they get into a situation and they haven't taken it, but they've ingested it somehow. But I always am really a big promoter of that type of thing. A stop the bleed kit for our officers and our buildings. I'd love to see a stop the bleed kit on every one of our school buses. I'd love to see Narcan on all, or naloxone on all our school buses, but that's being hit with some resistance from OSPI because of temperature swings and such like that, and keeping that drug safe. But there are also unions that we have to be concerned about because they don't want to put drivers in that position to have to give it and such. And Lena had mentioned a while back about, and Lena, you chime in here briefly about, a situation, somebody with that has epilepsy or something and has maybe an order to give this medicine, but the bus driver, excuse me, isn't trained to do so. You want to talk about that a little bit, or have you already?
I don't think I discussed it with this group. One of the things, so what Mike is alluding to is one of the things that when you're preparing care plans, to be aware of EMS response time in your area, but also their orders and regulations that they have to fall under when they're giving care. In one of our schools, they found out that the EMS doesn't carry an anti-epileptic on their ambulance, and so we explored the opportunity of carrying the Valtoco with the doctor's order that they would have at the school, and apparently EMS could not give the Valtoco without contacting the hospital or their supervisor. So if you're setting up care plans or have students that have extended bus rides or other kinds of needs where you may need to have EMS intervention, it would be a good idea to ask those questions and make sure that you take that into account in your care plans. Mike, I'm not sure if you have any more to share. I didn't want to cut you off, but we do have a little bit more time left that we need to still hear our school nurse updates. So I wanted to just check in with you about what you may have left that in your talking that you want to share before we move
I
on
can
to
make it very short
Kathy.
and sweet and wrap it up. And if you have any questions, you can, feel free to always contact me. Carry non-latex or latex-free gloves. Make sure that you're changing them out often, especially in your vehicles and such, because they don't handle, the heat well. Think about our gangs and our different colors and such. It's no longer the Bloods and the Crips. It's Sureños and Norteños, and we are seeing a very large uptick in our gang situations, even in some of our smallest districts. It's incredible. They've gone down somewhat over the COVID years, but they're back with a vengeance. Don't be afraid to excuse yourself immediately if you just feel that hair on the back of your neck cropping up. Double up with others. For those of you that are doing home visits, make sure you keep or get and maintain a good first aid kit, not only for you, but for those that you may be working with. And so my last highlight here is always keep a watchful eye and be prepared for the unusual. That will always serve you well. So I can give a lot more information and I can show you more of these functional annexes, but don't be afraid to go to your building administrators and say, hey, What is our emergency operation plan? Or what is going to be our next required exercise? Do you know when it is? How can I help? Because you are an absolute vital part of it. So I'm available for questions, but I know you've got some other business to tend to as well.
If we have anyone that emails us any questions, I will be sure to pass them on to you, Mike. So thank you for your time. We always want to be working the solution and not becoming part of the problem. So thank you for your perspectives. I'm going to turn the time over to Kathy so that way we can have our regional nurse updates. And all right, take it away, Kathy. Thanks.
Okay, well, thank you. The first thing I want to do before we get into this, largely because we only really have 10 minutes left in the meeting. And so the first thing I want to do is introduce Garth Donald to you. Wave Garth. And I think one of the most important things is for you to meet Garth and know who he is. Garth is new at the Chelan Douglas Health District, and he is going to serve as our mental health and substance abuse coordinator there. So we are so grateful to have you on board here. Garth is going to be available to help you with naloxone training and other services specifically for Chelan Douglas County. So Garth, would you like to say hi to everybody?
Yeah, I think that's an excellent introduction. Yeah, Garth Donald, exactly what you heard, mental health and substance use coordinator for Chelan Douglas Health District. Right now, the big project that I am working on is I'm getting a naloxone trainer training so that I can go to different organizations and be able to pass my skills on so that a handful of staff members can teach more within for within the school, for example. So I'm sure you guys have all seen the bill rolling out. We're almost certainly going to have naloxone stocked at all high schools. And I do think it's something important that everyone is aware of what it is, how it works, and some of the finer details of it so that you can use it with confidence and use it safely. So I'll be reaching out to everyone, and I'm sure you'll hear from me soon.
Great. Thank you so much, Garth. And if you want to put your contact information in the chat, that would be great. We're also introducing you in our newsletter that'll be coming out this week as well. And we have your contact information in there as well. So in lieu of time, I'm going to skip through these slides relatively quickly and just know that you're going to have all these links. So you have all the links to all this information, and so you're not going to miss out on anything here. So the first thing I want to point out, we're going to go through some Washington DOH updates. Right now, they're collecting information from schools based on the new concussion reporting tool that just came out last year. So you recall that we are now required to report concussions to the state. And so they're looking for feedback now from schools about this new process. So just know that you might be getting this, or somebody else in your school might be getting this link, and it's a relatively quick survey. Look, only 2 questions. So there's not a lot to it. It's pretty simple, but they're looking particularly from schools who have never reported a concussion to them to find out what might be preventing that from happening. So know that that is available right now. Also, some new tools that are available to you. One is a new radon page that Department of Health has just recently launched. So just know that you can click to this for information on radon. I think last week I sent you out a link to the free kits that they have available. They have a limited supply of free radon testing kits for schools. So you're welcome to fill out a link, see if you can get a free kit, but they're relatively inexpensive as well. So for about $20, you could probably buy a radon kit for your school. And that would be something you could connect with your health department about to have more discussions on environmental health of your schools and find out a little bit more about the testing that's going on in your school buildings. Another this is free and it's new. It's just been updated. And so it's been reposted, and it's the safe cleaning and disinfecting guidelines. So this also came out of the Environmental Health Office. And it used to be, when you saw earlier, Ray was showing you like the 2014 infection control guidelines. Those guidelines are really under revision right now. We're still using the 2014 guidelines, but we're anticipating revisions to those pretty much any time right now. In the meantime, environmental health has gone ahead and pulled this section out of it because they really wanted to get you some more current information on cleaning and disinfecting. So this is out of your manual. It was one of the appendices in the manual, but it's now been replaced. Another new thing that's come out of Washington DOH are the new kiosks that are going out to all LHJs in the state. Every LHJ is eligible to receive one, and these are going to include free test kits. A variety of test kit types are going to be in these, and then health districts can put other free things in here for the public as well. And so there is one already in the Chelan Douglas Health District, so they've got their kit, or their kiosk is posted, and Okanagan County and Grant County Health District are also eligible to get a kiosk and are just looking at where they might place theirs right now. So those are coming. Naloxone, we have gotten our supply, so we are collaborating with the Washington Department of Health Overdose Education and Naloxone Distribution group, and we have received our dosages to distribute. These are the ones that high schools are eligible to receive. So we've got these available. If you didn't fill out a request for them earlier, but you would like your district to get 2 free doses, please don't hesitate to ask for them. So there's a little link to a little agreement where we ask that you just fill out a couple of questions about getting these free doses. And the most important thing is we want you to fill that out so we know you have them, and then you're eligible to get refills. So as long as these are available through the Department of Health, then you could be eligible to get free refills from them as well. So please don't hesitate to fill those out. It's for all high schools and high school programs. So your any high school program that you have on your site would be eligible to receive a couple of doses. Couple of just these bill updates, just things to keep in mind. These bills are still currently in process, but are looking good. So we're looking very hopeful that these are going to go through. One has to do with the fentanyl education for school districts, so expanding fentanyl content for education. One has to do with epinephrine and the standing orders for epinephrine for all school districts. One has to do with the extension of the naloxone law to go beyond the schools that have 2,000 or more kids, and we're going to bring them into more schools. And then the other is bleeding control. And so that one is going to be bleeding control plus a semi-automatic AED at all schools. So we talked earlier, Mike mentioned the, stop the bleed type kits. And these actually, if this continues to move through as it's looking pretty positive, then it would become a requirement for all schools to have bleeding supply materials. So some of these things, because in lieu of time, I'm just going to move through them because you're going to be able to read these in the minutes or in the PowerPoint when it comes out. I do want to point out your Washington State Health Code update. So make sure that you're updating your health codes in your electronic systems. So look for those. If you're not sure where they are, you can find them out on the Google Drive. So look under your district assessment Google Drive folder, and you'll see the Washington Student Health Codes in that folder. Not too many changes this year, but there were about 6 or 7. So you might want to make a note of that in your systems. And those of you who need Skyward and cumulative training, we have some upcoming events. We want to make sure you're aware of those. Reminder about your district assessment, and we ask that you complete those and return them by March 29th. And for those of you who are involved in collecting data with the University of Washington, looking at school nurse issues and staffing that report is out. And so I've got the link in here for you. It's posted down on our Google Drive, and I would encourage you to either download it or print it if you can, and to read through this, about 20 pages. It's just excellent. Mayumi Wilgorod was responsible in large part for this, as well as other people from across the state, collecting all this data. And I thank all of you who were involved in that process, because it's been really valuable, and we'll be using this research for Washington to help with school nurse staffing. SNO has launched its new website, so make sure you go out and take a look at that. You should have gotten a link from SNO so that you could go in and access the members only content, but look for yourselves out here. I would encourage you to do so. There's many pages out there that have a lot of school nurse pictures from our region, and so I hope that you can take a little bit to look at that. We're also going to be reminding you about the upcoming March SNO conference. And the SNO Research Committee. I just want to let you know, one of the projects we're working on right now has to do with school nurse competency and how we're doing performance evaluations. And I'm working with a student right now from the RN to BSN program. He's going to be launching a survey. I want to thank those of you who had opportunity to spend a little time with him. Lacey Chamberlain in Okanagan spent some time with Freddie, as did Amanda Peasley. And so I thank you for your time with him. And we're going to be taking his survey questions, putting them into an electronic format, and sending that out to everyone. So thank you in advance for filling that out. It's going to be a big help for him. And we're going to be using that in our work on developing some standardized processes for performance evaluations. Okay, so just some quick training and resource updates. We talked already about the health equity training that's going to become a requirement for all licensed folks, including registered nurses. So this has a link to your different training requirements on here, and you can log in and complete some free training for that before your license needs to be renewed. The DISH program, just upcoming dates, so you know what we've got still for February, March, April, and May. So if you're interested in more diabetes training, that monthly meeting is available for you. School Nurse Connects, those of you who participated in the past in School Nurse Connects, we've got another session coming up, and it's February 29th. So these are usually about a quarterly presentation that's offered in collaboration with OSPI, and this particular one will be on eating disorders. And so we've got some folks coming in from the Emily program who are going to be presenting on eating disorders in adolescents. And luckily, now we have also this new tool that has come out on eating disorders in adolescents from Washington State Department of Health. And this is about a 6-page guide where you can see it's like a little toolkit. It's got screening tools and a lot of other great information in it for you. So just encourage you to take a look at this tool as well. And of course, we've got it saved for you already in the School Nurse Drive, so you'll be able to access it in there. Another module that we would just want to encourage is the scope and standards module that NASN has created, as well as the National Association of State School Nurse Consultants has been working on this in collaboration with NASN, and they have now launched it. And this is a free training program that's available to you. You can complete it online. It's created in 3 separate sections, so you don't have to do it all at once. And I think you'll find it really a worthwhile program. So take a look at that. We also talked quite a bit today about emergency management. So I wanted to make sure that you're aware of the multiple trainings that are available on emergency management. These can introduce you to the ideas of what an annex is and the various roles that school nurses can play in working with their team at their district on their emergency operations plans. And then on the SET course, for example, is a triage training that's offered to you through NASN. So there's just a variety of things that I've posted out here that are available to you, as well as some seizure updates, because we get some requests about that. And I just want to make sure again that you are aware of quite a few opportunities that exist for you to get more training on seizure management. So with that, I'm going to go ahead and stop because we are at our time. So thank you so much. We'll send you the PowerPoint. It's going to have links to everything in it so that you can get to what you're looking for. But I do appreciate all your time and your participation on all these different surveys that we're going to be sending out, because it is so valuable for us all to be looking at your opinions and your feedback on what's happening in your district, so we can help you as best we can. So thank you.
Thank you, Kathy, and I'm sorry about the abbreviated nurse update today. But as Kathy said, we will be sending out the slides, so you'll have all of those links to the information in those slides, and that will be available to you shortly. We want to again thank Ray and Mike for their words and their wisdom in sharing with us today. I am going to share a quick slide with you here. Let me make sure it's up. So this is just a quick reminder that clock hours are available. And now that you have watched the live Zoom, you can go in and complete the PD enroller survey. Sheila usually takes attendance in this live Zoom, and so that PD enroller survey gets sent out to you, and then you will just pay for your clock hours, and that's how you receive them. If you are watching this on the recording, this slide is information on how you can still get those clock hours, even though you weren't able to attend live with us. So with that, we want to thank you for your time and being with us today, and hope you had some informational or some eye-opening information was here for you, and that you're feel more empowered to be prepared in your schools for any given situation. So with that, we thank you and send you out with your
Lena,
students for your day. Oh, Carrie, yes.
really quick, I put into the chat box about the spring conference.
Yes, you did.
cost and
Yeah,
what-
thank you.
So, I also put my emails in there. If you guys did not receive the email from me with the password to the members only section in the SNO website, please send me an email to one of those and I will get that out to you.
Fantastic. Thank you, Carrie. Thank you for bringing that up again, and with all that extra information in the chat. I will see if we can put that out there somewhere so people can see that. All right. Thank you so much. Have a great rest of your day, everyone.